Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the global pandemic of COVID-19. As we've said before, the pandemic was relatively slow growing until about mid-March, and then it began to grow very quickly and has been growing weekly ever since. This is total deaths. As of last Thursday, 872,000 deaths and 26 million confirmed cases worldwide. And as I've pointed out many times before, these numbers are tremendous underestimates because there are many countries that don't have the capacity to be testing or reporting. This is the pattern of growth that we've seen worldwide, but it's important to remember that this is really a combination of the pandemic spreading in different areas. So you have countries like South Africa that are growing quite quickly, Brazil that are still growing, but not as quickly, the United States, which appears to be slowing down, and then countries like Belgium and others in Europe that have apparently reached close to their maximum. So if you look back historically, the epidemic began in China, then spread to Europe, then to North America. And by the middle of April, by the end of April, really, it had spread pretty much everywhere. If you look at the top 20 countries in the world with deaths per million, a couple of months ago, it looked like this, with white being Europe, blue being North America, and pink being South America, and yellow being other. This week, it looks like this. And again, if I put them side by side, that's July 5th there on the left. This is September 3rd, 9 weeks later. And you can see some pretty significant changes. Peru, which was not even in the top 10 in July, is now number one, having more than doubled. You can see that all the South American countries are moving up. The European countries are still up there, but their growth has been much more slow in the last 9 weeks. The US has dropped from 7th to 8th, but has still increased almost 50% in that time. So again, think of it like ripples in the water expanding over time. The pandemic really began in China, then moved to Europe. It's now into the Americas and starting to spread in other parts of the world as well. So it's a global pandemic. It's still evolving. It has reached different levels of maturity in different countries. There's a great deal more information about COVID-19 on the College of Public Health website if you'd like to go there and click on this icon. If you know folks who would like to be added to our mailing list, please contact Jan Stork. I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. And as always, if you have any questions or any comments or would like us to cover any particular topics, please let me know. I look forward to hearing from you. Thank you very much.